The placebo effect is a positive response to a substance or procedure known to be without any therapeutic effect for the condition being treated. Note, this makes evaluation of effective treatment difficult. The word placebo comes from Latin, I shall please, and when used in this context refers to effects caused by people's beliefs or expectations. The best known example of the placebo effect is the effect of sugar pills to mimic drug effects, cause side effects, and dependence. In order to demonstrate that a drug has unique effects, the effect of the drug must be compared with the effects of a placebo. It has been shown that a placebo is 56% as effective as morphine. In a double-blind design, researchers cannot inadvertently communicate to subjects what changes are expected of them. In the 1950s, Cobb, a cardiologist, performed fake surgery in which surgeons made fake incisions in people's chests, but did not tie off their arteries as was done at the time for angina. The fake procedure was just as effective at decreasing chest pain. Additionally, research by Kirsch found that antidepressants were no more effective than placebos for those who are mildly or moderately depressed. In Britain, they only give antidepressants to those with severe depression. Right now, many people believe copper and zinc increase circulation and decrease pain. This appeals to those suffering from arthritis. What's the problem if it works? It may avoid medical care and paying for treatments that don't treat the problem. The nocebo effect is the causation of sickness or death by the expectations of sickness or death and by associated emotional states. Some examples of the nocebo effect are Luprello and colleagues in 1968 conducted a study on asthmatics. Asthmatics were exposed to nebulized saline, innocuous salt water, and told they were inhaling irritants or allergens. 47.5% of the participants experienced significantly increased airway resistance. 12 asthmatics in the study developed full-blown asthma attacks and were relieved by the same saline when presented therapeutically. Controls, those who didn't have asthma, were unaffected by exposure to the same stimulus. One asthmatic who was allergic to roses reacted to plastic as well as real roses. Let's discuss some of the theories to explain the placebo effect. Anxiety. This effect is due to anxiety reduction. Placebo effect in pain is larger in subjects with a higher state of anxiety. Cognitive. This is due to the expectation of receiving medicine. Subjects still act drunk when drinking non-alcoholic beer. A person allergic to flowers still sneezes when smelling a fake flower. Conditioning. A history of medication use leads to a conditioned placebo response. Determinants of placebo-nocebo responses. Let's discuss 3 variables involved in placebo and nocebo responses: patient, provider, and situational variables. Patient variables. A subset of patients show a significant placebo response. It is not possible to identify in advance this subset of patients. In fact, by the 1970s, the consensus was that there was no consistent placebo responder. The same people may not respond reliably to placebos. Any procedure can, under the right conditions, produce a placebo effect. These right conditions are unknown. Provider variables. A doctor's ability to convey the sense that treatment will be effective in a warm, caring manner increases placebo effects. Taking time and not rushing them strengthens the placebo effect. A doctor's behavior pre-surgery can decrease post-surgical pain. A provider's faith in the treatment increases effectiveness of the placebo. Situational variables. Pill shape, size, color, and quantity can affect the response. Consider the following. IV is greater than injections. Injections are greater than capsules. Capsules are greater than red pills. Red pills are greater than white pills. The more a drug seems like medicine, the more effective it will be. As Taylor in 2006 stated, foul-tasting, peculiar-looking little pills that are taken in precise dosage, take 2 as opposed to take 2 or 3, and that are taken at precise intervals will show stronger placebo effects than will good-tasting, candy-like pills with dosage levels and intervals that are only vaguely indicated. Take 1 every time you feel uncomfortable, for example. Therefore, prescribing exercises and dietary restrictions will show weaker placebo effects than pills and other meds. Finally, setting events. The more medical the environment, the greater the effect.